Testing knee flexion against gravity position. Patient will be prone. First thing you'll have your patient do is perform knee flexion to the best of their ability. So go ahead, Owen, flex your knee all the way up as far as you can go and bring it back down. Because he was able to do that full range of motion against gravity, that is a 3. Now Owen, come up about halfway. I will stabilize the thigh, apply resistance just proximal to the ankle. So go ahead, resist me. 3, 2, 1. Let back down your leg. Depending on the resistance level that he gives me, I will rate him as either a 4 or a 5. Testing knee flexion, a gravity eliminated position. Patient will be sidelined. The first thing you will do is support the opposite leg of whatever leg that you're testing, and then have the patient bend the leg that you're obviously testing. So go ahead, Owen, bend your right leg for me. If there's any movement going on here at the knee while in a gravity eliminated position, that would be considered a 2. If there is not any movement, then you would palpate for the hamstrings. If you feel these muscles firing, that is a 1. If you do not feel them firing, that is a 0. Knee extension against gravity position. You'll have your patient in a seated position with their knee approximately 90 degrees hanging off the table. First thing we'll do is, Owen, extend your knee out as far as you can. Bring it back down. Because he was able to do this, we know that he is at least a 3. Now, Owen, I want you to extend it out again, except only go about halfway. I will apply resistance to the just proximal to the ankle, and stabilize the thigh. I will apply resistance. Owen, resist me. 3, 2, 1. And there we go. Knee extension, gravity eliminated position. I will first pick up the opposite leg to allow full range of motion of the leg that we're assessing. Owen, extend your knee as far as possible. Now, because he was able to perform that motion with gravity eliminated, we know that that is at least a 2. If he could not do that, then I would be palpating the quadriceps.